You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, laser dentistry, specifically to treat gum disease. According to my first guest, no more bleeding gums, loose teeth, and bad breath. With us, we have an expert on the topic. He is a board-certified periodontist, Dr. Haghighat. Dr. Haghighat, welcome to the program.
Pleasure to be back.
Now, we've had you on the program before.
Yes.
Talking about dental implants. So always a pleasure.
Thanks
to
for having
have
me
you on
back.
the show. And so for people that don't know you, though, your practice,
Yes.
where is it located? Who's your typical patient? And what are the different procedures you do, since most people don't know what a periodontist does?
So the majority of the practice deals with gum conditions, disease being one of them. So
Like what?
patients
Like what does
are
that look
losing
like?
teeth because of periodontal disease. Okay. And what we do is we have basically a variety of treatments for them to try and save those teeth. Be it traditional gum surgery that we do for them. There are aesthetic treatments that we do, for example, patients with gummy smiles.
All right.
So we go in and correct the gummy smile so they get a more beautiful smile. Patients that have become long in the tooth.
What does that mean, long in the tooth?
They have recession. The gum has receded back from the tooth. So they're longer in the tooth when they smile.
So what do you do?
So it's not attractive. So what we do is we have procedures that will correct that.
Like adding gum back?
Adding gum back. So we have a variety of methods to add gum back to the teeth that are longer now and make them the normal proportion.
Is that from brushing too hard?
There are many different reasons.
What's the reason?
One is yes, bad habits that you pick up while brushing. So patients become scrubbers, and that is damaging. They think they're doing a good job by cleaning more forcefully, but it creates recession.
Okay.
That's one reason. There are a lot of other reasons. Disease is one of them. Inflammation, for example, which is really what gum disease is all about. Inflammation that is created by bugs, bacteria that's in the mouth, that creates recession too.
Okay, so let's define gum disease, because I guess this is a big problem, right? I mean, most people have it, a little bit of it?
Yes. According to the latest data out from the American Academy of Periodontology, close to 50% of the population have gum disease. One from whether it's severe to moderate to slight.
And this is the number one reason why people lose their teeth?
And this is the number one reason people end up losing a tooth or all their teeth.
So what are the symptoms?
So we have patients that complain of bleeding, for example. The most common finding, the most common sign.
But when you floss, a little blood's okay?
Yeah,
or
that's
no?
iatrogenic. Yes, you can create damage to the gum by flossing incorrectly. But for the most part, you get bleeding because there's inflammation there, because the bacteria has taken over and you are a susceptible person that has created damage to the structures around the tooth. Therefore, it becomes inflamed and it bleeds. So inflammation is not a good thing. So once you see inflammation, for example, is the first reason to say, question it. Why is it bleeding?
So bleeding is bad. I mean, that's bad.
Bleeding is
what.
bad. It's like anything, anywhere in your body.
And your laser, and I have questions about your laser, by the way,
Yes.
but and I don't want to oversimplify it, but if you catch it early enough, I mean, this laser going around the mouth with a laser will stop the bleeding gums?
It is a really convenient way of treating inflammation.
Okay,
and we'll get to that.
Bad breath as another symptom of gum disease.
So one sign, yes, we discussed inflammation and bleeding. The other, puffiness. Gums look puffy, look inflamed.
So red puffy gums.
Red puffy gums. It's not a good sign.
Well, what's going on that's causing that?
Well, really, when you look at gum disease, it's a bacterial insult. You have bacteria growing inside these little crevices.
So
next
under
to
the gums?
Under the gum, where you can't reach with your regular brush and flossing, it accumulates there, and it creates inflammation. And inflammation is not good. The body doesn't like it.
So under the gum line, so I understand this correctly,
Yes.
you've got a bacterial infection.
You've got bugs, yes.
You've got bugs.
Yeah.
Is that right? Can you see them with a microscope, by the
You
way?
can see them in a microscope, yes. It's not done routinely every day because we know what it is now. But yes, you can take a little sample and put it under the microscope and see these little bugs move.
So puffy red gums.
Yes.
And if you do nothing, these puffy red gums turn into what?
And in most cases, it advances to the more severe gum disease, which is periodontitis. So you have the gingivitis group, which is really inflammation of the surface layer of the gum.
Okay.
And then if it's untreated or not treated correctly, it advances to more severe forms of disease. So you tend to lose bone, for example. So when your dentist tells you that you've lost bone, it's because you're getting to that more advanced stage of gum disease.
That means the tooth is actually coming out.
Eventually it will do, yes. So it's untreated, or it stays there for a long time. You lose support. Teeth become mobile, for example. You see shifting of teeth.
So loose teeth.
Loose teeth is another sign of the quiet disease known as gum disease, because it's painless.
So it's a chronic infection under the gum line.
Yes.
And bad breath, though. How does bad breath, what's the connection there?
Well, bacteria causes an odor. And if you have lots of them underneath the gum, food trap, producing a lot of byproducts, the bacteria will create a foul smell.
Have you ever had patients that if you, I guess, kill this bacteria with a laser, is that what the laser does?
Yes.
That their bad breath goes away?
So the aim of the laser therapy is to attack the bacteria. So that's the primary aim of doing laser therapy, which is not as invasive as what we used to do. And it really attacks the source, which is the bacterial accumulation around teeth.
Okay, now you are a gum specialist, a
Yes.
periodontist, right?
Yes.
So you are the person, when the gum disease gets bad, they're sent to you, just so I understand this timeline here. And there's two ways across the country of how this bacterial infection is handled.
Yes.
One is to cut it out.
What is
right?
the traditional way?
Cut it out.
So
and
every
clean it?
periodontist is really trained to cut away bad tissue. That's the traditional approach
So like
to gum
infected
disease.
tissue.
Gums that are puffy, gums that are infected, chronically infected. What the training, or what we used to do, and still carry on doing it, it's the majority of periodontists around the country will go and remove this diseased tissue. So it's resective. You're removing tissue from your body. So that's one approach to it. The other way to treat gum disease really is to attack the bacteria and the inflamed tissue less invasively. And the laser plays a big part in that. So the laser, what it really does, it's a light source, to make it really simple, and it attacks the bacteria. So by illuminating the bacteria through this laser ray that is put inside the pockets, you get rid of virtually 99% of the bacteria that's creating havoc.
So anything you hit dies. That means
dies.
okay, so it's a bacterial infection in the mouth.
Yes.
You could cut it out, or you can laser it out.
You can laser it out. So the lasers that are specific for gum disease, they're very selective. Not all lasers are the same, and that's
Yeah, because you
a
said
key point.
you have an FDA approved, the
Laser.
only laser
Yes.
FDA approved for this
There are
condition.
so many lasers out on the market, but there's only one that is FDA approved, and it's specific
What's it
for
called?
treating. It's called Periolase.
Okay.
It's marketed by Millennium, the company, and really, when you're seeking laser therapy, you should ask, which laser do you have? Because
Interesting.
really, the only laser that is effective in treating gum disease is the Periolase.
Now, knowing you're coming on the show, okay, so I see things like no more cutting, no more stitching.
For the most part, yes.
I mean, there's like a movement of, and we should also mention, I guess, less than, and again, if you're just tuning in, we're talking about no more bleeding gums, no more bad breath, loose teeth. We're talking about saving teeth and killing gum disease. I guess periodontal disease, is that the same thing, by the way?
Yes.
With a laser, rather
a
than
laser.
the old-fashioned way. I'm calling it old-fashioned, rather than
Yes.
just cutting it out.
Cutting it. So it's less invasive. It's like keyhole surgery in medicine.
So less than like 8% of all dentists in America
Have the laser.
have the laser.
It's like any new technology, it's very slow to catch on.
But the no more cutting, no more.
It's very attractive. It's attractive for us.
But that
as
slogan,
treating-
is that real?
No cutting, no suturing, and virtually pain-free. So through our experience with the patients we've treated over the past 12 months or so, yes, it's true. So patients typically come back or call us the next day and report that there's virtually no pain. Advil is the most they take, even though we give them something stronger in anticipation that, potentially there could be more pain, but never used.
Here in California, a periodontist, I don't know her very well, but I've interviewed her, and she said, Randy, as a periodontist, she goes, treating gum disease was not a sexy thing to do. It wasn't fun. No. You didn't want to call the patient the next day. Well, she has one of these lasers.
Yes.
And she said, now it's fun.
It is fun.
Now you can call them and they're happy.
It's
It's
the
different,
nicest
I
thing
guess.
to have patients that are happy. You know, the old days we used to have really long treatment sessions, and also, you know, treating the full mouth, which typically these patients require, would take months and months and months because you had to section the mouth into four, do one quadrant or one portion at a time.
Is it
and
true it's hard to get them back?
It's hard to get them back.
'Cause
So
it
you
hurts
do
a
one
lot.
or two at the same visit, and then the next visit they say, "Doc, I don't want the other ones done."
So it's a very painful
It's a very
procedure because the
painful
gums
procedure
are sore?
because you're peeling the gums back, and that's where the pain starts. It's initiated by the reflection of the gum, and you don't have to do that in laser periodontal therapy.
So you've been using this since the beginning of 2012?
2012, yes.
Okay.
So we incorporated the laser, the periolaser, in our office, and over the past 2 years, nearly a year and a half or so, we've treated almost everyone. There are exceptions. I mean, laser is for most people, but there are certain conditions that you really have to do the traditional approach therapy. But for most patients, we've managed to at least arrest and correct their condition with the laser therapy
Now,
alone.
so I guess general dentists could also have these lasers. Do you feel that if you're going to get this done, go to a periodontist that has one?
Well, I'm biased, obviously,
Okay.
because in any treatment, when you decide to embark upon treatment for a patient, it's diagnosis and then it's execution. So the correct diagnosis before you select the case for treatment is key. So we're at an advantage that we know what the best treatment is for the case. So I'm biased towards, yes, we'd like to be the ones that are treating gum conditions.
So do gum disease patients know who they are? That means they've been
They do.
told?
They've been told. They know.
And they get
all the
deep
symptoms.
cleaning after deep cleaning?
We see patients that go to maintenance therapies, cleanings every 3 months, and they're told, yes, it's still inflamed here, and yes, it's still bleeding there, but come back in another 3 months, and we'll keep an eye on it. Well, to me, it's almost like supervised neglect, and really, there's treatment for it. The treatment is to eradicate the problem so the patients can manage their periodontal health at home and reduce the visits that they come to the dentist.
Okay, so logically, I interview a lot of medical doctors on the show, and right now there's a lot of buzz about gum disease and
Yes.
periodontal disease and bleeding gums. But if it is a chronic infection, as you say it is, then logically, if you're cutting it out, right, scraping out, you're still leaving a bunch of stuff behind.
You do.
If the laser goes in, kills this infection of the targeted areas that it hits,
Yes. So really,
I mean, it sounds like it's a more effective
it is
treatment.
when you look at how periodontal disease spreads and how it really forms. It's inflammation, and inflammation is caused by the bacteria that's in there. And the bacteria really resides in not only on the tooth surface, which we mechanically try to clean every time you go for a cleaning, it also penetrates tissues. And that's where it stays in. So we're really not attacking the bacteria deep within the tissue. So a lot of it stays behind. So the logical way is, why not kill the bacteria that's also within the tissue?
Makes sense.
So the laser beam, with the way, when I said it's selective, it really attacks the bugs that are within the tissue.
Let's talk about results. What do you mean they're quick? I mean, what goes away right away?
Inflammation. So inflammation really is what
Like
disappears.
symptoms, though, for the patient are what?
The bad breath goes away quickly.
Okay.
So within a week of patients coming back, the first thing is that the bad breath is gone because the bugs are removed.
Interesting.
The bacteria is gone.
Okay.
I've had patients, the last patient that I treated over a few sessions, they're a couple. The wife said, hey, you need to go and see your periodontist for your gums because, one, you have bad breath and these teeth are moving and mobile and they're out of position. So aggressive as it was, and the patient was very nervous, because they didn't want to go through the conventional, what they've heard, conventional therapy. So we opted for laser treatment. We treated the full mouth within a matter of 2 hours, 3 hours. And within a week, when the patient was back, the wife was more thankful because we've managed to correct the future husband.
But of the people that you've done the laser with, that had loose teeth.
Yes.
How does doing the laser make the teeth strong again?
Well, loose teeth come about because of inflammation. Inflammation really creates some mobility.
Like the gums are pulling away from the tooth? Or
Gums
what?
are pulling away from the tooth. Then there are forces, when you bite together, the tooth doesn't have enough support. So it creates some adaptive mobility to the forces you put on it. By creating a healthier environment around the tooth, the ligaments that are holding the tissue or the tooth in place, they tighten up.
So the gums actually tighten against the tooth again?
And holds the tooth more securely. Yes.
Interesting.
So that's
Is there some regrowth? Because I know
there will be some regrowth.
in skin, when they laser skin, they get new collagen, et cetera, et cetera.
Yes. So
same thing here?
The aim is really what the laser does. Once you remove the targeted inflamed tissue, you leave behind healthy tissue. So the old school, old traditional way, you would inadvertently remove healthy tissue as well. Now you're leaving healthy tissue behind, and that is the foundation for new healthy tissue to grow back up again. So it makes sense that why not just be selective, remove inflamed tissue, don't create the postoperative issues that we had with the traditional approach, and let the body heal from within, just like medicine. I mean, a lot of the conditions we suffer from is nowadays we think about inflammation just within our bodies. So dietary components are in. So we change our diet to get rid of inflammation in our body, and we feel much better. And yes, we do have a link between all these bacteria that's inside the mouth. It's a direct connection because of
if you have blood in your mouth, it's going into your bloodstream, right?
It communicates, exactly. So
interesting.
What we have is all this inflammation going to different body parts. So there's a direct communication with patients with cardiac issues.
Were you skeptical? Because look, I've talked to periodontists.
Absolutely.
They are divided, it seems like.
By nature, I'm skeptical because I always want evidence-based
Because you're
therapy.
trained in surgery, is that
Yes.
correct? To get rid of gum disease.
I've always looked at evidence behind anything I offer my patients. So this, initially, yes, I was skeptical, but the research is out.
Is there science
Absolutely.
behind this?
I mean, when we first adopted the traditional approach, there was one paper, one of one. The periodontal therapy with lasers, there's a lot of research.
You've been a
out.
periodontist practicing for over 11 years.
Yes.
Okay. Back then, would you have poo-pooed this and said no?
Absolutely, yes. And I did.
And
Because lasers have been out for that long. But the research obviously was weaker back then. And now with, just like anything in medicine, things develop.
I had a hygienist tell me,
Yes.
by the way, recently. She goes, the lasers don't work. They even could burn the roots of your teeth. So what do you say to something
There's
like
no
that?
truth in that. I mean, there's plenty of research
they do
showing
work. It
that
does
they
work.
do work. There's plenty of research done correctly, like anything else that we do. It needs to be employed correctly.
So no more
There's
bleeding
techniques
gums,
involved,
bad breath, you get stronger teeth.
stronger teeth, and hopefully save your teeth.
So
But the key thing, Randy, is to get people in the door quickly. There's no point leaving this for years and years till it's to an advanced stage.
So the general dentist normally handles this, right?
Handles this.
And then when it's so out of control,
Then it's,
they end up with you.
will you help?
Is that right? As a
Yes.
periodontist?
So what we're trying to encourage our colleagues,
The general dentist.
general dentists, is to, once they notice, signs of gum disease, signs of advanced gum disease, make a referral. Send us the patient for an opinion.
So when I hear like I haven't had this done, but root planing, and this is like a deep cleaning.
Yes.
A lot of this could be done
So
by different
that's-
settings on the laser.
So that's the initial approach to traditional therapy.
Okay.
So we do scaling or root planing, which is really scraping of all the buildup that you have on the roots, and that gets a bit of inflammation down.
Okay.
But it's not definitive. In most cases,
But it's not clearing up the infection.
It's not. No. For some cases, very early on, slight cases that are not too advanced, yes, it does help. But in most cases that are deeper pockets, which you have difficulty accessing it, it's not a definitive treatment. And to take patients month after month or every 3 months through that procedure is really not benefiting the patient. So what the laser does, what we'd like to do is get the patients in quickly in these severe
Earlier stages.
earlier stages and treat them. Because the laser makes the cleaning of the roots, the scaling and root planing portion, easier. It's done at the same time as getting rid of all the bugs and adjusting the inflamed tissue. So it's all done in one visit.
Now, you brought a video.
Yes.
So what are we going to look at? I guess this is how the laser works.
So this is an animation, basically, of
Okay.
what lasers do, how it works. And really what it shows is the removal of inflamed tissue. It's targeting inflamed tissue. It shows that the scaling and root planing portion of it is done immediately, same visit, so there's no point for multiple visits. And it shows how the healing happens.
Okay, good. We'll go to the video.
Okay.
This is the video animation of the FDA-cleared periodontal procedure called LANAP, an acronym for Laser-Assisted New Attachment Procedure. The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
Interesting. I mean, is it tricky? I mean, is there a learning curve?
Yes, there is a learning curve. There is training involved. In fact, Periolase Millennium, who really
That's the manufacturer?
That is a manufacturer who has this specific laser, the only one that's out there for this treatment.
Now, with let me get some stats here, or approximate, because I'm putting you on the spot here. But would you say that every single day in Oregon, 20, 30, 40, 50 of the cutting procedures are being done that leave people sore every single day, that some of those, many of those could have been done with this
with the
laser?
non-invasive laser therapy? Absolutely.
Really?
So we can switch.
So millions across the country every single day?
Millions across the, I mean, the numbers, I said 50% of the population have some form of gum disease, and probably about 10% of those are in the severe category. And 10% of the population is a huge number. So traditional approach would be cut and suture. This is no cutting, no suture, and virtually pain-free.
Do you think, okay, so if there's 60 million people that have no teeth
Yes.
in the U.S., do you think if they all were lasered early on, at the early phases, do you think you could have eliminated some of that? I mean, this is your gut opinion.
Absolutely. I think so. I mean,
Like
I
80%
believe
of it,
so
90%
that,
of it?
I believe that a lot of the patients that end up losing teeth is because of either bad advice for leaving conditions too late to be treated, and the therapies available are not really attractive. I mean, if you tell somebody I do that day in, day out, or I did until 12, 15 months ago. The options were I need to do, cut your gums and open things up and cut more, and in order for me to do the cleaning and reposition things. Yes, you're going to suffer from sensitivity, and no, it's not going to look that great. So that's not an attractive option for the patient. So they would put it off. They wouldn't come back again.
So if you can laser it,
what do? I mean, you keep going with the same disease, and when they come back, is at a point that tooth needs to go. But if we can laser it, and it's easy for the patients to accept, which it has been for the past 15 months or so, then great.
Final message though, and for people out there, okay, bleeding gums, bad breath, puffy red gums, and I want to ask you about that because I see those puffy red gums. I don't think of it as gum disease, but are you saying that if you catch it early enough, those puffy red gums will go away with a laser?
You can eliminate it. Yeah, I mean,
Is that right?
you can't reverse disease.
But have you seen it, by the way?
It.
Have you seen it? Let's talk about your clinical experience.
Absolutely. I mean,
you've seen reversals in these symptoms.
Reversal in the symptoms. So the inflammation goes, the bad breath disappears, the puffiness goes because the inflammation's gone. Teeth tighten up more. So the mobility in some of the cases disappear, and patients are left with a healthier mouth, which reflects in a healthier body in turn.
So when people lose teeth, it's not so much the teeth, it's the gums?
It's the gums. Most of the cases, yes, there are situations where, the tooth is non-restorable, decay, fractures. But for the most part, the number one reason for tooth loss really in this country is gum disease. And it gets to an advanced stage that the tooth really needs to go.
And it's a bacterial infection.
Bacterial infection.
So rather than cutting it out, laser it out.
Laser it out, yes.
And you're killing the bacteria.
You're killing the bacteria.
I know I keep repeating this, but
Yes.
it just seems so logical, at least.
I mean, if you have an infection, which is mostly caused by bacteria, you want to go to the source of the problem, which is the bacteria. And that's always been a struggle. So now we have a device that potentially removes 99% of the bacteria that are creating the problem.
So insurance?
Insurance covers treatment, yes. So
a lot of the
laser therapy really falls under, surgical therapy.
So if it's
most
covered by
insurance-
surgical therapy, it'll be covered by this.
Exactly. So it covers it.
And I'm not trying to side with you, but it's hard not to on this on this program. But go to a periodontist.
Go to a periodontist.
It doesn't cost more to go to a periodontist.
It doesn't.
That has a laser.
Fees are set. I mean, insurance companies, for the most part, set fees. So we are guided by them. So it really makes no difference whether you go to me or you go to a general dentist.
And you want to get them
Separate
early.
fees. Absolutely. So really our key, and my emphasis has always been correct diagnosis at the start, correct treatment planning, and most importantly, correct execution of that treatment plan.
Okay, great.
So I think we're set more favorably to do that.
And it doesn't really hurt.
It doesn't hurt.
Nothing
No,
to worry about.
No hurt. No pain. As the logo says.
I mean, very little
no
pain, so I don't have to put this
expect that you have to,
some
take
soreness and
some Advil, but overnight. But the next day, guarantee you'll call us and say there was no pain.
Okay, good. I want to thank you for coming on the show. Very
welcome.
good. Very
Thank you.
interesting. Good
Thank
for
you.
you.
Thanks
Good
for
you.
having me.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can go to our website at wellnesshour.com and just put in Dr. Haghighat or Oregon Laser Dentistry. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.